Of things that have also made this of interest, and that's been the rapid evolution of new and promising technologies. Up in the upper left there is something called Wii Fit. It's a video game. You can go try it out when you come down, if you come and visit our booth. But it's a game system that helps people do physical things. Well, there was a young woman that graduated out of Elon University in North Carolina just this past year, who did a remarkable study. She went to an assisted living area and showed people if they got in front of this thing and used it, their balance improved. In fact, it improved better than young sorority sisters of hers getting in front of this thing trying to improve their balance, although they were probably doing something the night before that would take away from their balance. But when you get down to it, think of improving balance, the reduction in the likelihood of falls, and the reduction of likelihood of mortal injury as a result. It's rather remarkable. The big technology giants are getting into this space as well. When you start looking at such things as Health Vault, the ability to put in one place all of someone's records so that they can be used. If you go to Microsoft's Health Vault space, you find out what they're after. It's helping you get rid of your notebook. Likewise, Google Health. They did something very interesting. In fact, yesterday, we had Martin Harris, Dr. Martin Harris, who's the CIO at the Cleveland Clinic, who worked out something with Google Health so that they can stay connected with their patients by sharing their information through a very secure way with Google Health. You staying connected with your doctor. Companies like UnitedHealth Group, we're very proud of what we've built. An online tool, a personal health record that you don't have to populate yourself. We will take our information that you sent us when you sent us a claim and populate it into your personal health record. So you already have a listing of what kind of problems you've had, what kind of medications you're on, what's been done about it, and what things you can be working on. Automatically pulse when it's time to take your next pill. It also helps you call in refills. It also helps you switch from retail over to mail order if it's necessary, and change profiles and send texts, etc. Powerful tool. There are other great things. For instance, Vitality, coming out with glow caps to remind people. Or Philips, who has a device that goes in the home that releases the regular combination of pills for each period of the day when the patient has it, automatically prepackaged in a way in which the user has a ready delivery. Another area that's very important in healthcare is access. We're going to be facing an access crisis this decade. By the end of this decade, we're going to have 45,000 family physicians, family and internal medicine physicians short of what we need to be. In order for us to deal with that, we have to come up with new ways of providing access. We are relying on telemedicine to do so. In the middle here on the bottom panel is something called Connected Care, where we build remote access so that patients in a remote location, at work, at a nursing home, or in the office of a rural clinic can hook up directly with a specialist who can use all kinds of digital diagnostic equipment, including stethoscopes, heart monitors, blood pressure machines, diabetic glucose monitors, etc., eye examination kits and all, to do remote testing so that people can get tested, including going to the next level with our Now clinics, being able to bring a doctor right into your home, a house call, electronically. No matter who your insurer is, we have the ability to provide you with an appointment. Doesn't need any fancy equipment other than a secure video line, a Skype type thing, in which we can create a direct and secure channel between the patient in the home and outside. One last area is, before I turn things over to Gail Hunt, is to look at the impact on technology on a very important clinical professional in the United States, the family caregiver. There are some 66 million people who are caring for a loved one in this country. Think about it, 66 million. They are delivering $375 billion worth of uncompensated care. Think about it. The surgeons the medical workforce, doctors in this country, is only 750,000. There are 66 million people whose only license to provide care is their family relationship. And yet, when you look at what they go through, caregiving represents to them stresses on their life, stresses on their finances, stresses on their own health. We look at technology as a way of closing that gap. And with that in mind, I'm going to have Gail Hunt come up, who's the president and CEO of the National Alliance for Caregiving, to present to you something we call the E-Connection Family Caregivers Analysis, bringing caregiving into the 21st century. Following that, we're going to have comments from Lori Olaf, who represents Aging in Place in the Technology Watch, Dr. David Lindemann, who is the director for the Center of Technology and Aging, and then Andy Cohen from Caring.com, who will all provide to you their perspectives on technology and its role in the caregiver and the older patient. Gail?
Good afternoon. I'll just get started while we're bringing up this PowerPoint, and this just, okay, just go like, oh, just go like this if I want it to advance it. Oh, use the clicker, sorry. Okay, just really briefly, the National Alliance for Caregiving is a nonprofit coalition with about 40 plus national organizations that have come together around the issues of family caregiving. We do most of the national research around family caregiving. So, for example, a national caregiver survey that we've done every 5 years, and we look at caregivers, men as caregivers, long-distance caregivers, all kinds of stuff around caregivers and work. And with UnitedHealthcare, our funder in this case, we've also done studies of caregiver health, out-of-pocket expenses, and Hispanic caregivers. So you can go to our website, caregiving.com, and you can see all of the studies that we do. We post everything. So this is a study that we've done specifically for this conference, actually, an online survey of 1,000 technology-using family caregivers. It was funded by UnitedHealthcare, as Dr. Migliori said. The definition of a family caregiver is somebody 18 or older who's spending at least 5 hours a week providing care to someone who needs assistance with everyday activities, but they don't have to live in the same household. And actually, I think you'll find these people are doing a lot more than 5 hours a week and are really serious, what we would call from other research that we've done, really serious caregivers. We also know that all of the people that we surveyed in this, obviously they're online, there was an online survey, but that they've used the internet in the past to find information, or they've been in a blog, or they've used electronic devices. And just to give you a framework, in the National Caregiver Survey, only about 70% of all caregivers have used any of these. So we were zeroing in on that 70%. And the purpose of the survey was really to find out how receptive they were to 12 internet technologies, plus sources of information technology that they trust. I'm going to go through this, I understand, very quickly. There's tons more data, and you can go to, again, our website or UnitedHealth's website, and I'll have them both posted at the end, and look in detail at the findings, as well as see the instrument that we used to do the survey. So there are 55 million family caregivers of adults. That corresponds to the 66 million who are, that Dr. Migliori mentioned, are caregiving for people of all ages, and that includes children with special needs. The profile of, for those of you who have ever worked in this field, the profile of the family caregiver is a 46, 47-year-old baby boomer woman who works outside the home and also cares for her mother. As Dr. Migliori mentioned, the economic value computed by AARP was $375